everyone, and thank you so much for your interest and coming along to be part of today's session. Before we start, I would just like to take a moment that we're all used to the virtual way of connecting, but I think it's important just to take a moment and perhaps just feel your connection to the ground and to the land, and recognize that while we are in this virtual space, that we are embodied beings and that we are connected through the virtual world because of our shared interests and our shared humanity. And as I do that too, I'd like to take a moment to acknowledge the ongoing and traditional custodians of the lands that we are joining today from, and that's across much of the lands that we now call Western Australia. And where I put my feet on the ground, that's the Whadjuk people of the Noongar Nation. And I would like to pay my respects to their elders past, present and into the future. At Health Consumers Council, we do an acknowledgement of country at many of our events, but we try to make sure that it's not just a rote thing, but that it's done with heart and meaning. As someone who is relatively new to Australia, you might be able to tell that I'm not from Australia originally. It's been a real privilege in my life to learn a lot more about Indigenous culture and the strength. It's been great to be part of a community that has such a strong and enduring connection to culture and land. But I do want to acknowledge my sorrow at the impact of colonisation and dispossession that is being felt by many people in the community today, and state that Health Consumers Council are willing to be and keen to be partners as we walk towards reconciliation with Aboriginal and non-Aboriginal people. And I hesitated briefly there because I can see the message from Susan. And Susan, can you are you able to message back and forth with Rachel or Nadine, just to make sure that the experience is the right one for you? So Rachel, that is Susan put a message in the chat. Fantastic. Okay, so in a moment I'll introduce Robyn Lawrence, who's going to be talking to us today, but just a couple of quick etiquette points. We have had a lot of questions in advance, and we've tried to group these generally into categories, but it's going to not be possible, undoubtedly, to answer every single question. There were also quite a lot of quite specific questions. So for a few of those, we're going to come back to you directly about those with specific answers, but generally we'll be going for broad general questions. There are also some questions that weren't about the COVID Care at Home programme, and again, we will try and respond to those in other ways. So first of all, Robyn, if I could just introduce you and say thank you so much for being part of this session today. You're a very, very busy woman, and we really appreciate the time that you've taken to be with us. We have obviously found out a little bit more about COVID Care at Home, but could you just tell us just a bit about the programme and how it came to be put in place? Like, what's it hoping to achieve?
Thanks, Claire, and thanks everyone for joining. I also would like to acknowledge the traditional owners of the land. I'm on Noongar country, the country of the Whadjuk people, and I would like to pay my respects to their elders past, present and emerging, and acknowledge the contribution to the community that they have made over many tens of thousands of years. The COVID Care at Home program came about really as a mechanism to support people who have risk factors in caring for themselves at home. It emerged during the Delta outbreaks in the East Coast, where we watched closely what was required to support the community at that time, and to help people avoid having to leave their homes to go to emergency departments if they didn't need to, where it was very busy, and there were also additional risk factors in that. Delta was quite different to Omicron, and there was also the issue that people tended to deteriorate quite quickly with Delta. And so the routine monitoring and the use of the pulse oximeters, which are the little monitors that go on. I think I got muted externally. Yes. Sorry, yeah. I'll try and keep an eye on that. So I was talking about the little pulse oximeters that we use during Delta that go on people's fingers, measure oxygen, were quite important to high-risk people with that. So with that in mind, we set about establishing our program, having learnt the lessons from Victoria and New South Wales, to try and pick the best of what they had and to work with an established provider to be able to deliver that. So the program we have delivered has morphed a little bit from the Delta days to the Omicron version, recognising that there's many more cases of Omicron, but that in fact, in general, the majority of people with Omicron remain relatively well and can care for themselves and their families at home as if it's any kind of other sort of respiratory virus. Some people do have gastroenterological symptoms, so you might get nausea, vomiting, diarrhea. That is much more common with Omicron, and there's some of the things that people need to be considering. The service is designed for those people who do have higher risk factors for deterioration. So people who are immunocompromised, have significant chronic disease, such as heart disease or respiratory disease, diabetes, and the older person, particularly if they've also got some of those conditions. We don't exclude people whether they're vaccinated or unvaccinated. Obviously, if you are unvaccinated, you do have a higher risk, but if you're vaccinated and you've got those complex conditions, you are still eligible for the program. We expect that that's about 10% of our community who are eligible for the program, and the other 85 to 90% will be given advice to take care of themselves at home. And all of that advice is on the internet, both on our site and lots of other people's websites. Also, general practitioners are critical to supporting people at home, particularly those who are on a self-care program. If people need advice, or they need advice particularly about their usual healthcare needs, that they can still contact their GPs. Obviously, telehealth appointments are critical if you've got COVID, unless you really need a face-to-face appointment. So to register, you can go to our website and you can register there online, and it's quite a simple process. Or if you're unable to do that, somebody can do it on your behalf. So there's the ability for somebody to register for somebody else, and that's documented that you are doing that. Or you can phone 13COVID and they'll assist you to register so that you can still be part of the program, even if you can't navigate the website. There's capacity for interpreters, there's capacity to be able to communicate with people who are hearing impaired or who have speech difficulties via the National Relay Service. Once you're accepted into the program, if you're deemed to be of higher risk, then we'll be contacting you every day, running through your symptoms and how you're feeling. If you do need further clinical support or escalation to specialist care, that will be arranged through the program. And there's also a telephone number for people to contact the program care team outside of those regular contact times if needed. To be able to do that contact, you do need a telephone. We can use a standard landline. We obviously can't do a video call on a landline. So if people have got access to video calls on their smartphones or via a computer or a laptop, they will be utilised. For people who are travelling okay and aren't particularly unwell, they might also do SMS check-ins with you. So there's a range of ways we can check in with people to make sure that they're progressing as expected, and if they need any escalation of their care. For people who need it, and it won't be everybody, we do have pulse oximeters that can be distributed and they'll be sent to the person's home if they need it, one per household. So if you've got a number of people in the household who have COVID, yep, I can see someone waving one around. It's great if you've already got one. You can share it, you just need to clean it in between. Not everybody will need those. If you've got an underlying respiratory condition, you're much more likely to need an oximeter than somebody who's got a different sort of condition, just because Omicron doesn't seem to have the same respiratory complications that the Delta variant has had. For people in the regions, we are starting to distribute those up front to people of the highest need. It's a bit challenging to identify everybody who needs one, but we're doing our best for those people who live more remotely to get it out to them before COVID comes into their households, because obviously it's much more difficult to deliver things in real time if you live hundreds of kilometres away. For access to the antivirals, I know a lot of people are interested in that on this call. There's an assessment as part of that home care program that will be undertaken to see whether you fit the criteria. The criteria are very tight for the antivirals for a couple of reasons. One is they're only effective in mild disease very early on. So you've got to be within 5 days of diagnosis or symptom onset. You've got to have symptoms ideally to receive them. So if you're completely asymptomatic, you're probably not going to qualify. And there's quite stringent conditions around the degree of immunocompromise and those sorts of things. They are not in plentiful supply, but currently we've got enough in the state to meet our needs for now. But of course, the whole country is using them. They come from something called the National Medical Stockpile. So they come to us from the Commonwealth and they deliver them in volumes as we need them according to the outbreak. That's just to make sure that no one state has more than they need at any one time. That goes for both the oral antivirals and the one that goes into the vein, the infusion, which is the drug called sotrovimab that you might all be aware of. They're both, all of those drugs are accessible via the same means. General practitioners will be able to provide them directly for patients in nursing homes and from the Aboriginal, the ACCHOs, through the Aboriginal Controlled Medical Services, they will have their own supply. So slightly different for a couple of sectors, but in the main, through the same process. If you've chosen not to be part of the COVID Care at Home program because you're receiving your care through another provider, that's absolutely fine. That provider also can refer you directly through the hospital system, through the infectious diseases doctors for access to those drugs. So just because you're not part of the program, if you've got conditions that would qualify you, you still can get access either via your GP or via your specialist. It's probably worth people who are likely to be eligible with chronic disease or carers for people with chronic disease, particularly the immunocompromised, having a chat to their clinicians who normally look after them, just so that you've got a plan on what to do should you catch COVID and you know how to manage it both from your own perspective, and your family can have some reassurance about how that care is going to proceed, but also if you do need to get access to those drugs in a timely way so that you know exactly how to navigate it and you're not worrying about it when you're also not feeling well. At the end of the program, so the program runs for about 7 days, which is about how long most people have symptoms that require care. At the end of that, you'll be discharged. You also get released from isolation at that point in time, assuming you are asymptomatic at that time. And there is a discharge summary that will go to your general practitioner if you've provided the contact details and consent to it going through to them. I should have said the program is run by Calvary Medibank, which is a joint venture of 2 healthcare providers that when we went to market were the successful bidders for the program. They're very experienced, having worked in both Victoria and New South Wales through the height of both the Delta and the Omicron outbreaks. So they've got a lot of experience in delivering this service. And I think positively, they've got a big workforce that's already in place, having traversed the outbreaks on the East Coast, which are now coming down. They're based all over the country, but they are all Australian registered practitioners. So they're not necessarily based in WA, but they are in Australia and they're not overseas. I might stop there and go to questions, Claire.
Thanks, Robyn. You've answered a few of the questions that had come through already, and it's great, like you said. So there was a question, I think, about the kind of the staff, the qualifications, the sorts. What are the professions that people will be talking to if they are if they're in the program? And I might just pause just briefly. There we are. We have Taryn. Welcome, Taryn. So sorry. So yeah. So in terms of who are the staff? What kind of qualifications do they have?
So they're clinical staff, doctors and nurses predominantly, but they are supported by admin staff. It's a large program. So SMSs and things like that might be sent by their admin team, but they've got on-duty nurses and doctors at all times, access to Aboriginal health practitioners. That was a requirement of the tender, that either they had Aboriginal qualified staff as part of the program or access to an Aboriginal health practitioner to support our Indigenous community. But if you need care escalation, they're essentially well-trained GPs who have got experience in managing COVID, who would deal with the escalations and people who may be becoming more unwell.
Great, thank you. And I think one of the things when we'd spoken about this before that you had mentioned, and just to reiterate, you've mentioned it briefly, but that kind of no wrong door into the levels of escalation. So if somebody is seeing a GP, or if somebody is in the program, that if they do need their care to be escalated, that they will end up being, they don't have to be in the program in order to be able to get escalated.
Absolutely not. So general practitioners will use the usual process they use if they're concerned about a patient, to either get advice or to refer a patient to hospital. And the COVID care at home team will refer them via our patient flow coordination centre. The reason we've got a slightly different process for COVID care at home is really to try and have as many people not having to go to the emergency department if we can safely admit them directly to hospital if needed. From general practice, that's a little bit more complex to navigate, but if the general practitioner is able to call the hospital, that may be able to be arranged as well. And it's going to really depend on what the person's needing care for. So if it's related to your underlying condition, it may be that you go to the care of your usual care team. If it's really predominantly COVID, then you might go to a different unit. So having that clinician input is really critical in making the assessment of what you as a patient require at that point in time.
Yeah. We had quite a few questions come through in advance, and there's a couple I can see in the chat too, about the other support that people, if someone tests positive, they register for the service, and they, for example, are a carer for a family member or another loved one, and so they themselves have become unwell, how does that service, or how does any service then support that person, so that the person they were caring for is still able to be cared for, even though that person may be quite, the original carer might be quite unwell with COVID?
Yeah, look, I think that's a difficult scenario. We're aware of that, both locally from our own cases we've seen already, but also from the East Coast. The COVID Care at Home program would refer that family group or the carers to our complex care team, who would assist in trying to resolve that scenario. The COVID Care at Home program is all online or virtual, so they can't assist with day-to-day things in the home, but they can refer people on to the services that are more likely to be able to connect up and provide that assistance. Where possible, we obviously strongly recommend that people in those situations do try and have a plan in advance to think about what they would do in that, what they would like for their loved ones, whether it's a child, whether it's somebody else there with a disability they're caring for, whatever the circumstances. And if you have that documented in advance and have spoken to the people who you think might be able to help you out, then that's always really helpful to be prepared, even if it's a discussion with social worker or whoever about how that might happen. Knowing what you want when you're not feeling so well is really important.
Yeah, and thank you. And we know that there are some resources online, and we'll be sharing them both after the event and on our website for people to step through all the things to think about. And I know that, for example, Albany local government has worked with their local health service to really put some very thorough plan and documents in place, and we got them shared to us by WAFA. So thanks to all of that. Just a few questions then about still accessing the service. So if people don't speak English and they have a positive test, what's their way into this sort of service?
So if someone can't help them register, then they can call 13COVID, and they will work with interpreters to be able to register them, and that information does go into the system, and COVID Care at Home can work with interpreters to try and support those people at home and care for them through that process.
Great, thank you. And we had a question too for people, the escalation pathway, given that this is a virtual service, obviously the experience of people of COVID care at home in the metro and the regional areas will be the same. But if, for example, escalation is required for people who are living regionally or in remote areas, how does that look?
So the COVID Care at Home team has worked very closely with the WA Country Health Service about adjusting some of the parameters we would use for people who are more remote, acknowledging that it might be a bit more time till they can get to healthcare if they need that acute escalation. So we have that in place. If a person in the regions needs escalation of care, that will go to the WA Country Health Service. Obviously it goes to the ambulance, but WA Country Health Service, and they will manage it from their end, as they do know their services much better than the COVID Care at Home team, given they're not local, but even better than our Metro team, who will liaise for Metro patients. Great,
thank you. Now you've spoken a little bit about, people can go through their GPs and so on. Is there any relationship between this programme and people's GPs? So would their GP be notified, for example, that they've been part of the programme?
The GP will be notified when somebody is discharged from the program. They won't be notified up front. For people who are on self-care, we do recommend that people let their general practitioner know, even if you're caring for yourself at home, that you've been diagnosed with COVID. Drop them an email or just give the receptionist a call and they can note it in the record. And likewise, if you have a usual practitioner, you might like to just let their rooms know that you have been diagnosed so that they're aware. But we won't be letting general practitioners know as a matter of course right at the front of entry.
Yeah. Okay. So one of the things that has obviously we've seen reference to a little bit is the question of long COVID. And I know you said that about being discharged from the programme is about that 7 days, and then the care then is going back into the community-based, which would be the general practitioner. Has there been any thinking about how we track to see if people are ending up with long COVID?
That's probably a bit out of my remit, to be honest. There's a lot of research on long COVID and which people are likely to develop it and what the consequences are. And that research is becoming available now. Some of you might have seen it in the press recently, that it does appear to be some increase in heart impact with long COVID. And we're looking at what those demands are going forward into the future. But it's not directly linked to the program in any way.
Thank you. So we did touch briefly on this already, but we had quite a few questions both about from carers about if they themselves get sick. Are carers able to register the person, say for example it's the person that they care for, are carers able to register that person in the service?
If the person's got COVID, they can.
Yeah, sorry, that's what I mean.
Yeah. So a carer, a friend, a GP, a support worker, anybody can register another person and assist them with that process. Ideally, they should have your consent first. We haven't had it for the program, but we have had people putting in fake RAT results for other people and quite maliciously, which is problematic. So I'm going to assume that people would consent to them. They're somebody else doing it for them. But yes, absolutely. Anybody can register you if you can't do it yourself or you need some help.
Yeah, great, thank you. Sorry, in terms of getting the information out about the service, so it's wonderful that you've done this with us here today, and that we know that there's a number of non-government organisations who themselves will be spreading the word about this to people in their networks. What other plans are there to make sure that the community and the information about this service reaches the people that it needs to?
So we have done a lot of work with general practice, both WAPA, RACGP and the community controlled sector. We've also done work obviously with our own clinicians and encouraged them to let their high risk patients know of the service availability. Mm-hmm. The other thing that happens is if you get a positive COVID test, whether it be a RAT test or a PCR test, you will get a message from our public health team, and it does have a link in there. So everybody, if you test positive, should get the link. I know it's a pretty stressful time when that happens for some people, so not everybody reads everything, and I think you get several messages now of different things saying do this, do this, do this. But it is there for people who aren't aware of it in other ways. Yeah.
And I guess I know that certainly my reflections on this whole situation at the moment is that this is a really great role that the community can play, is that, you know, I know that personally I shared information about this service in a community Facebook page in my region, and I was surprised at the number of people who said, oh, I would be eligible, but I didn't know about it. So it's great. I mean, I think, you know, for example, if we've got about 70 people on the call today, if every one of us told 2 other people, then, you know, we're amplifying that information quite quickly. One question that has come up in terms of, you know, obviously capacity is a difficult thing to measure, but what kind of capacity does the service have?
It's got a lot of capacity, so it's been challenging to model how much capacity you really need, but we've factored in a very large volume being available for what we would anticipate may be our peak required. I think what we're seeing at the minute is the take-up's actually pretty low of our current cases. So we just have to see how we go as we go forward, how busy the service actually gets. But given we're coming off the peak in the East Coast, which we didn't quite anticipate we would be so dislocated in our timing, that's good for the capacity of the service, but we had factored in a large volume. Yeah,
that's great to hear. And then another part of that capacity, we've had a question about if, for example, somebody needs an ambulance to be escalated into hospital, is there a separate arrangement with the ambulance service for this service, or does this then go into the general ambulance queue?
It goes into the general ambulance queue and be triaged consistent with everybody else. The reason for that is obviously some people who need hospitalisation will be far sicker than others, and there'll be people having the usual strokes and heart attacks, which also need to be accommodated.
Yeah. And then, so switching slightly, a little bit about if you have symptoms and you're waiting for the results of your COVID test and you need medical attention because the reason, your symptoms are progressing, you can't register for the care at home because you don't have a positive test yet, and you probably won't be able to see the GP because you have got the symptoms and they tell you not to come in. So how is it? What's the official kind of what a person should do in that scenario?
So there's a couple of options. Most GPs will do telehealth consults, and that would be similar to COVID care at home because it is a telehealth consult. So I would go, order of priority, I guess, is your local general practitioner and a telehealth consult. I recognise that some GPs are very busy and can't fit that in. The GP respiratory clinics are designed to see people face-to-face with COVID symptoms and respiratory symptoms. So that is another option. And of course, if you are deteriorating and you're really unwell, then you do need to seek emergency care via an emergency department.
Great, thank you. You mentioned the GP respiratory clinics. Could you tell us just a little bit more about those?
I can do my best. Again, they're not mine. They're a Commonwealth government initiative. They're spread predominantly through the metro area, and I understand they are seeking to have some more. I can see somebody's moving very quickly there to put some links up. They're available to anybody, and they do face-to-face. They also do COVID testing on site if it's required, but they do formal respiratory assessments of patients who have respiratory symptoms, whether they be COVID or non-COVID, at a time when we know some practices aren't comfortable seeing people face-to-face with those symptoms.
Great. One of the questions that we have had, and I know again that this might come slightly out of the remit of this call, so it might be something we have to take on notice. And I'm learning to pause my speech a little because I know I do talk quite quickly, so I will try not to.
And we've just swapped interpreters too. My apologies for interrupting, Claire.
No problem at all.
Draw your attention to that.
Yes, thank you. And sorry, I just need to so sorry, if someone is shielding and so they for their own risk, they've decided that they are either staying at home or someone who may be housebound or homebound for other reasons, so they're not able to leave their home even to get a test. Are there some processes in place for how people in that scenario can get access to tests?
So it is possible in the metro area that the general practitioner could organise a test at home. There isn't large capacity for home tests. With the increasing availability of the rapid antigen tests, having some of them available at home is probably going to be the best option. And obviously the Commonwealth Government has released some of those at no cost to some groups in our community, not to everybody. The price does seem to be coming down commercially across the board. And our government is also looking at options as more RAT tests become available for the community.
Yeah, thank you. And I know too that we've been working and we've been part of the conversation with the WA Council of Social Services too, to try to just get a little bit more understanding of how community organisations can get hold of some more of those rapid antigen tests so that they can then also provide them to vulnerable people that they might be supporting. And we're eagerly awaiting the advice about that. Now, again, this might be something that we need to take on notice. We've had a fair few questions come through about people who are immunocompromised and how do they isolate from positive people in their home. I wonder if there's anything that you are able to offer on that, or a referral, or like for somewhere else that we can point people to for the information about that.
So the information on isolation in the home is all available on the website. It really doesn't differ for what reason you're doing that. I mean, we would like everybody to isolate from a COVID positive person in their home if they can. I think the key things are the COVID positive person, where possible, should remain in their own space, so in their own room. I think it's complex if these are young children, and we know a lot of our cases at the minute are young children or young people, young adults, who hopefully are slightly more able to isolate. But if you're caring for a child, I think there is always going to be challenges in that unless somebody else can give you a hand. But ideally, they stay in their own bedroom. If they do have to come out and use shared facilities such as bathrooms and kitchens, that they wear a mask at that time and that there's nobody else in that space, and that then the surfaces are wiped down, ideally with just a standard cleaning product that's got some sort of disinfectant cleaning process. So most of the ones you buy in the supermarket are completely adequate. Wearing gloves obviously also helps that, as long as you change your gloves as soon as you've touched the surfaces and completed what you need to do. Recommendations around the linen, and that other people don't handle the linen. Again, that's not always practical. If you do have to handle the linen and you're compromised, masks, gloves, and try not to get it on your clothes, or otherwise change your clothes at the end of it. The risk from clothing is pretty low, much more likely that you'd pick it up on your hands and touch your eyes and cause infection via that mechanism. So I think the number one thing is stay apart as much as you can. And if you do have to be in crossover spaces, make sure you're not in that space. And if you can, leave time between re-entering that space and somebody who's got COVID having been in there, and the use of masks, hand hygiene and disinfectant on surfaces.
Great, thank you.
We also, just to I guess reassure people, COVID dies in the heat. So hot surfaces, and particularly in this weather, it's not going to survive very long. If you've got warm spaces, if you've got air conditioning, that's a bit different. And we always leave, we used to leave rooms empty for 3 days in the hotel. So if you're worried about spaces over time, certainly after a number of days, those spaces usually are no problem. I'm not saying you have to leave them empty for 3 days, by the way. I'm just saying if you are concerned, they're the sorts of timeframes we've built safety parameters around in the past.
Thanks, Robyn. And I know that it is a bit of a challenging time and can feel a bit unsettling when we have, one of the things we've heard from consumers in other forums is that kind of what feels like quite a rapid shift from we're keeping COVID out of WA and moving now to living with it. And so I think that it is wonderful with the benefits of the information can be getting out to as many people as possible. And I know that one of the ways, and you've pointed people, and we'll continue to point people to websites, but again, coming back to the point, for some people who may not be able to access information online or may not know about it, I know we spoke before about holding things like this, but are there any plans to go out specifically to particular groups that might be particularly vulnerable to make sure that they are able to reach that information in other ways?
So we've been working with our acute care clinicians who care for some of these people, as well as the broader groups such as Health Consumers Council, disability, aged care, to try and get that information out both to the individuals who are impacted and their carers and families. It is challenging. I recognise that. We do make everything available online these days, and that does mean if you don't have access, you are dependent on someone downloading it and printing it out for you. And hopefully some of these agencies can support that. But from the clinical perspective of clinicians contacting their patients and giving them specific information about their care type, I think has been helpful to those where that's been occurring. And I've had some feedback that that has been occurring recently, and people have found that positive. Chatting with your general practitioner, even your pharmacist to a certain extent, people have got good relationships with their pharmacist. There's a lot of information that they can share that they may have available. The government is trying to make stuff available in hard copy, but the reality is, how do you then get that to the right people is still problematic, I think. So we're doing the best we can. I also know there's a ad campaign coming from the government, which will try to simplify some of the messages. Probably doesn't meet some of the complex needs that we're talking about today. It's more that generic information about how to keep yourself safe and be prepared.
Yeah. And so I think what I'm hearing, and it's certainly something that we've heard from other people, is that if somebody might be in a higher risk category, is to get on their front foot now, if they haven't been already, and reach out to their healthcare team and or other supports to think about and put together a plan. And yes, like you say, Robyn, we know that some people have been getting telephone calls directly from specialist teams to help them bring to their attention that they are in a high risk category and talk with them about what options might be in place for that person. But I think that sounds like a message that everyone, and at Health Consumers Council, we're hoping to support that by putting together some workshop information with general information again about how to prepare and how to put things in place for yourself. But I do know that there are some people, I think, as we found another, for the whole last 2 years, that COVID perhaps has highlighted some underlying conditions in society where some people may be isolated, or and it's been highlighted particularly at this time of COVID when that becomes more acute.
Yeah. The other thing, there is a group who I guess is not recognising their risk, and that's pregnant women. So sharing the messages with pregnant women, particularly those over 28 weeks or those who are unvaccinated, is really important, because most of those women see themselves as healthy, which they are, but by virtue of the fact that they are pregnant, they are at increased risk as well. So that's a group which we are a bit concerned about, because they don't recognise themselves as being at increased risk of some of these things.
Thanks. With regards to the health services starting perhaps to reach out to people who might be in those high risk categories, is that something that there's consistently across all of the health services? Or is there a plan coming, if you like, from the department to make sure that that's happening consistently?
There's a plan on everything happening consistently. The clinicians are people just like us, and they get diverted and they get busy, and they've got different structures in each of the HSPs. So we would like to think it is consistent, but I wouldn't be surprised if somebody on this line told me it wasn't. We're doing our best to try and keep them coordinated and all doing similar things, even if it is slightly different.
Yeah, and again, we'll put these links in the information that we send out afterwards, and we have them on Health Insurance Council website too, that we know that South Metro Health Service, so that's Fiona Stanley Hospital and others, have put together specific information on their website for patients who are at higher risk because they're immunocompromised, and that information is pretty thorough. So we do recommend people have a look at it, and I believe some information is also planned for the Healthy WA website. Is that right, Robyn? Yep, I believe it's imminent. And so yes, I think again the key messages that we'll continue to support is make sure that if you spread anybody on this call today, please spread the information to other people in your networks and your communities that might find that helpful, because we all have a part to play in giving us all the best possible chance of having the best possible experience as we go through what the wave that is coming our way. We've got a couple more questions about the COVID care specifically. So, for example, if you're enrolled in COVID care at home and your condition deteriorates, do you call the service or do you go straight to hospital?
Oh, look, that depends on how sick you are. And each COVID care at home patient will receive information from the program telling them what sort of symptoms to look out for and when to call an ambulance and when to call the service. So if you're very sick, and the sorts of things we talk about, you know, a severe chest pain, then you will need to just call the ambulance like you would normally. We don't want people to be waiting at home. If you're uncertain or you're in that moderate risk symptoms, and I won't run through them, but they are on our website, when to call an ambulance, when to seek medical care, and they're separated out so you can tell. Then you'll be able to call the COVID Care at Home program or your GP if you're not on the program.
Yeah, thank you. And then if you could just reiterate how the service and the service itself will communicate with people who are deaf or hard of hearing.
So they can use the National Relay Service either in a voice call, or I understand there's also SMS messaging through that service. So we can communicate with people who are deaf and who have speech difficulties through that mechanism.
Thank you. Now, the question has come up about the availability of the relay service, and that might be something we take on notice. For example, is that 24/7? But it does raise the question of the hours that the COVID Care at Home programme is in place.
So currently the COVID Care at Home program is running 8 to 8, and that is based on the greatest time of need from what they've seen across the system. Of course, not everybody will get sick in those timelines, but because it's a daily check-in, the point is that we are tracking how people are progressing and if people are getting sicker or not. As case numbers go up and our volumes go up, there is we will expand the hours, but it will never be 24/7. The nighttime period, there'll be no service after hours.
Right, but just to sum up, what I think I'm hearing then is that because it's a monitoring service and those regular touch points will be tracking progress, that if you like, that's the point at which on that daily touch point, and so people are contacted daily in some way. Is that right? If they're enrolled in the program?
Yeah, it depends on how unwell they are,
right.
But it could be second daily, could be an SMS on alternate days, could be a daily call. Some people will get 2 calls a day if they're worrying about how they're progressing. So it is based on how sick you are at the time. And even if you have significant other conditions, it doesn't mean you're going to be really sick. So everybody will still be different on the program, particularly for those who have been vaccinated and have had a reasonable impact from that, which is more challenging for the immunocompromised. But for people with heart disease and diabetes and those sorts of things, you still can get some quite good impact from your vaccine. So you might not get really sick. There's also a clinical check-in in the morning with our team. And the purpose of that is saying, you know, we've got 10 patients who we think might need escalation of care today. We've been watching them. We're concerned about them. So that's flagged in the morning how many people we think might need admission to hospital during that day. So we're trying to be as proactive as we can so people don't need to make those emergent calls unexpectedly.
Yeah. You mentioned before about potentially some people being sent a pulse oximeter if they require one. Will the service also provide other consumables? For example, you talked before about gloves and masks. No.
No, so the only consumable that they will provide is the oximeter for those who need it.
Yeah. Great. And in terms of if somebody doesn't have access to a phone at all, so just to reiterate, you can access the service by landline,
yes,
or by SMS/smartphone. But if you don't have a phone, what is the option?
If you don't have a phone and you've got nobody at home who has a phone and you're high risk, you need to get in contact with us somehow. There's a few things about that in the first instance. With RAT tests, you might know you've got COVID, but with PCR tests, it's going to be very difficult to get the result with no phone. Mm-hmm. People without phones who are high risk are going to be at risk being by themselves because they've got no mechanism of contacting them. And it might be that those people in that scenario need alternative accommodation where there is a phone availability or care on site. But they will have to contact us because we won't know about them.
Yeah. Yep. And like we said before, I mean, I think what this has done to, so what I might do, sorry, I'll just pause for a moment as we manage the transition between the interpreters. And is that done? Yes, looks like it is. Thank you. We have pulled together a fair number of resources on the Health Consumers Council website, and we'll put the link in the chat, and we'll also send it about afterwards. The main things that we've tried to highlight are some general information for anyone in the community. Then we've got specific information for people who are immunocompromised or may have other underlying conditions. And just to be clear, at Health Consumers Council, we have not created any content. We are linking to the government sources and other sources of information. There will be a session being held on Tuesday, specifically aimed at people with disabilities. That's been hosted by the Disability Health Network and the Carers WA and the Health Department. And Robyn, I believe you're going to be getting back out on your speaking tour, which you must be getting quite used to doing at the moment. And then we're hoping to have another couple of community conversations. We're reaching out to a respiratory clinician in the WA Health Service, and also we're hoping to have, and then Robyn, I don't know if there's anything you can share. We've just heard about a new service called the COVID Care Assistance Team that may be getting stood up. Is there anything you can say about that?
Yeah, so the COVID Care Assistance Team sits within the public health contact tracing kind of team. They are one of the groups that could receive a referral from the COVID Care at Home team, or they might pick the patient up themselves through the contact tracing process. They have a survey or they're talking to people. So it's designed for people with complex social and welfare issues, which also can include some of the issues we've been discussing today, that you might be a carer for someone with a disability and you've got COVID, or the patient's got COVID, people who don't have adequate accommodation, those sorts of complex things, and they will help guide the person through that, make sure that their social and psychosocial needs are being met as best you can during that quarantine period. If there's need for alternative accommodation, helping facilitate that. The Department of Communities is also a partner in that. So some people may be referred to the Department of Communities if their needs are more simple. It could be as simple as something like, you know, I need nappies and I can't get online to get them. So some of those basic things that we don't always think about, that not everybody has the same level of access to in the short term when something unexpected happens, such as getting COVID. I think you're muted now, Claire.
Thank you. It has to happen. There we go. So the question that has come through there is just to clarify, in terms of how people get access to that COVID Care Assistance Team, is that is done through the contact tracing. Is that right?
It's got two mechanisms into it. So yes, they will aim. So they also do a little bit of a survey when people are now being diagnosed with COVID, and they pick up some flags through that. So they might contact people directly if they're picking up flags through their assessment, but also if the COVID Care at Home team detects that someone would benefit from that support, they can refer directly as well.
Great, thank you.
And I should also say to people that 13 COVID has links into lots of these things. So if people really don't know what to do, it's after hours, a range of different things. 13 COVID is a resource that is connected to all of the government services in a way. I know it can be frustrating sometimes, but it is the resource that is available and is able to connect people through those services.
And thank you. And that's a 24/7 number, is it?
I believe so, yeah.
Yeah, great. Okay, well, look, we're reaching the end of our session, and I can see some questions about, for example, how homeless people might get access into this kind of service. Is there anything you can say about that?
So there is a program working with homeless healthcare, and Royal Perth in particular is heavily involved in that through their homeless healthcare program. So Department of Communities obviously has good links to the groups who normally support homeless people, and Royal Perth has a big program that works with homeless people because a lot of them are in the CBD region, so they're aware of them. So it's difficult to get that information into the homeless person themselves because they're very disconnected. So having those connections to those services who can support them at the right time is the way we've tried to tackle that. As an example, there's been a program running where they provide some accommodation in the 24 to 48 hours post-vaccination, so somebody isn't on the street when they might not be feeling so great, having just been vaccinated. So there's a range of programs trying to reach into those most disadvantaged in our community.
Yeah, thank you, Robyn. And I know that it's been, I'm seeing a few messages in the chat talking about how informative today's session has been. So I think just to reiterate a few kind of key messages, I think one is to spread the word. Each of us can play a part in being part of a strong community response. So spread the word about the COVID Care at Home programme. And we will circulate an email to everyone who registered today with links that we've talked about. We'll also, and it will be a day or so, we will be putting this video up on the web. So we'll let you know when that's been done too. We do also want to just get some feedback from you about today's session, but also what other sorts of information you might like information sessions on, noting that there is a lot of information flying around the place, and so we want to try and get it to you in the most effective way possible that is easy for you to make your own plans and to plan with others. So spread the word. Make sure that you are able to put a plan in place, or if you need some more support in advance, reach out to the 13 COVID line, and the number is in the chat, and we'll send it out again afterwards. And please do spread the word. We know, like I say, that it's not been possible for us to answer some of the very specific questions, but behind the scenes we have been looking into options so that we can respond to some of those more specific questions generally. So really all that remains is the common way to end a Zoom meeting. So first of all, I hope you'll join me in thanking Robyn. Robyn is the Assistant Director General for Clinical Strategy and Planning, and it's been a real, it's been very, very useful, I think, Robyn, for everybody to hear directly from you. So thanks for being so generous with your time, because I know that it's a time of heightened work for many people in the system. So we really appreciate you taking the time. Thank you to everyone that has joined us here today, and please do spread the word on the evaluation form. We do ask if there's anything else you would like us to see what we can find out, then and we will do our best to do that. Thank you to Therese and Taryn, and all that remains is to do the Zoom wave, I think. So thank you everyone, and we will see you again, no doubt, in other settings, and keep the questions coming, and we will keep trying to get you the answers. Thanks everyone.